Hello, everyone, and thanks for joining us today. My name is Jason Lotzer, and I'd like to welcome you all on behalf of Blue Cross Blue Shield of North Dakota to the COVID-19 coverage webinar. So this update's for all employers on what Blue Cross Blue Shield North Dakota is doing to help you keep employees covered and healthy during these challenging times we're going through right now. Know that we're doing everything we can to help keep your business healthy from a financial perspective. These are unprecedented times, and we're monitoring the situation closely. We're following the CDC, state, and federal guidelines recommendations as they change. We're also collaborating closely with the North Dakota Department of Health, the North Dakota Insurance Department, and state leaders on a daily basis. So, like you, we're implementing change in policy in real time. This is really meant to be fluid, and the topics we're about to discuss reflect what's in place today. So, know that they may change as the situation changes. Just know that we're here to help you in any way that we can as we go through this content. For the agenda today, we'll be discussing expanded COVID-19 coverage, pharmacy coverage, telehealth visits, and finally, premium and employee eligibility extensions. To stay on top of things, we've got some resources put together for you to keep you updated as things change. You can visit bcbsnd.com/COVID-19 for more information. We're going to continue to host webinars like this as things change, and the newest from Blue emails will continue to be distributed. You can visit the Blue Cross Blue Shield North Dakota YouTube channel, and finally, if you're an FEP administrator, please check out fepblue.com. A couple housekeeping items before we get started. Everybody will be on mute during the webinar, but you will be able to ask questions at any time. If you look at the GoToWebinar panel, you'll see a tab where you can type your questions, and at the end of the presentation, we'll answer as many as possible. Just to note, we'll only be answering questions related to the agenda topics we're covering today. Other questions will be answered offline at a later time. If we don't get to your question before the webinar ends, we will be following up by email with additional Q&A and ongoing updates as we get them. So I'd like to introduce my fellow panelists and presenters today. Crystal Wheeler-Dennis, the Director of Pharmacy Operations. Mike Carlson, the Director of Employer Consulting and Wellness Services. And Chris Kalesa, who is the Director of Sales and Marketing at Blue Cross Blue Shield North Dakota. Welcome today, guys. Thanks again for joining us today and for your continued trust as we work through this together. I'll let Chris take it from here.
Thanks, Jason. We've received lots of questions from employers and employees, so our offices throughout the state are there to provide answers as we all go through this together. For the past 80 years, Blue Cross Blue Shield has been committed to working with its customers to ensure they have access to health coverage in good times and in bad. We stand by that commitment during this unprecedented time by removing some of the barriers. We're also staying in constant contact with our providers about any changes. We've expanded coverage to remove any barriers so that people are able to get the proper care. The coverage is retroactive to March 1st, and the coverage for services is consistent with the CDC guidelines. Because it's so new, the process may not be as seamless as in the past. Members may need to pay their applicable cost share at the point of service, but will later be reimbursed by their health care provider. The coverage is applicable to all individual business as well as employer group business across the board, including self-funded. For this testing, no pre-authorization is necessary. If your employees feel they have symptoms, they should call their healthcare provider and get instructions for the testing. We don't want cost to be a barrier for any member who needs a COVID-19 test, so Blue Cross Blue Shield in North Dakota will cover medically necessary diagnostic testing if ordered by a healthcare provider. The member won't have to pay their copay, deductible, or co-insurance. And it can be for a provider visit, the urgent care visit, or an emergency room visit. The FDA is evaluating home tests right now, but has warned consumers about unauthorized fraudulent COVID-19 test kits. They've not authorized any at this point, but are continuing to evaluate. Because home tests are not currently endorsed by the FDA, they are not currently covered by Blue Cross Blue Shield of North Dakota. If they come out with a different recommendation, we will reevaluate at that time. The IRS has even issued warnings about COVID-19 related scams, like calls and phishing attempts that can lead to tax-related fraud and identity theft. As mentioned earlier, things are changing quickly. As of our news release last Thursday, April 2nd, if an employee is diagnosed with COVID-19, out-of-pocket costs for covered services will be waived if they're medically necessary. No pre-authorization is necessary. They are applicable through May 31st, and the treatment may include inpatient hospital admissions and outpatient treatment for the virus. If there are any changes, we will distribute updates via our e-newsletter called News from Blue, but also on our website at bcbsnd.com/coronavirus. We also have dedicated clinical staff to help us answer questions during normal business hours. I'm going to turn this over to Crystal now for some highlights on pharmacy coverage.
Thank you, Chris. Blue Cross Blue Shield of North Dakota wanted to offer our members some flexibility during this time around prescription refills. So effective on March 10th, we increased access to prescriptions for members by allowing pharmacies to refill prescriptions earlier than typically allowed. Most plan benefits allow members to fill maintenance medications, so medications that are used for things such as diabetes, high blood pressure, cholesterol, and asthma, for up to a 90-day supply through a local or mail-order pharmacy. If members have questions regarding local pharmacies in network or how to sign up for mail-order pharmacy, please contact the BCBSND Contact Center utilizing the number on the back of your ID card or visit bcbsnd.com. We are working closely with our pharmacy benefits manager, Prime Therapeutics, to monitor potential watch lists for treatments and future vaccinations in relation to COVID-19. We are also closely monitoring any impacts to shortages of raw materials that may have the potential to cause a prescription medication shortage to ensure access for our members. And now I will turn it on over to Mike to talk about telehealth.
Thank you, Crystal. Hi, this is Mike Carlson, Director of Consulting and Wellness at Blue Cross Blue Shield North Dakota. As we see nationally, there's been a big push for telehealth visits. Online doctor visits reduce the strain on our healthcare system and limit unnecessary spread of disease. Your employees have a couple of options using telehealth. Your regular provider may have digital care option, so you should check directly with the provider to see. The other option is our partner Amwell. They've long been offering live on-demand video visits from a smartphone or computers, and users give them high regard. More in just a moment about how to enroll with Amwell. For self-funded groups, planned cost shares are waived for care related to COVID-19. Additionally, if using Amwell for care, we'll waive cost shares for all urgent care visits. For FEP, the Federal Employees Program, and our fully insured group business, we will waive the cost share for telehealth visits for nearly all services, whether they're using Amwell or a local provider for telehealth services. These services include things like urgent care visits, office visits for patients, physical therapy plan evaluation, speech therapy plan evaluation, behavioral health and substance abuse disorder treatment, diabetes education, nutritional counseling. Additionally, following CMS and the North Dakota Department of Insurance, a few telehealth services are not covered, or the cost shares are not waived. And those would be deferrable elective care, chiropractic care, dental care, and acupuncture. For Amwell, for fully insured and individual lines of business, first-time employees will use the Amwell site. They'll need to go through a simple enrollment process. During that process, the system will ask them for a service key code. That'll be BCBSND. Then, those members will want to use a coupon code of BCBSNDFI in order to have their cost shares waived. We do ask that self-funded employer groups talk to their BCBSND account management team for additional details that are specific for self-funded employer groups. With that, I appreciate your time and attention, and I'll turn it back to Chris.
Thanks, Mike. Utilizing telehealth is a great way for members to interact with their doctors and not have to go into any facilities. Now switching gears to premium and eligibility extension. Effective March 24th, Blue Cross Blue Shield North Dakota implemented a grace period for premium payment. If your business is a small group and has fewer than 50 employees, you'll actually have 62 days to make your premium payment as opposed to our normal 31-day requirement. If you can pay your premium though, we urge you to do so that you don't have a double payment next month. If you are able to make partial payments, that will also help. If your business is a large group and has 50 or more employees and you need to delay a payment, please visit with your Blue Cross Blue Shield rep. It's important to note that the grace period is not premium relief and that premiums will still be owed, but members and groups will have a longer time period to pay them. As businesses around the country are forced to reduce hours or lay off employees, Blue Cross Blue Shield of North Dakota has also allowed greater flexibility in eligibility requirements. As long as those premiums are paid, we will work with employers to keep employees on their health plan even when their hours fall below the current eligibility guidelines. We'll also soon accept credit card payments from small employers. This will help aid in their ability to make premium payments. And we'll also allow employers to remove or reduce current probationary periods for new employees. This allows those new employees to access their health plan sooner. If you find yourself making the hard decision to lay off employees in order to survive the pandemic, they actually may qualify for premium relief through the federal government's advanced premium tax credit. This would be a qualifying event for them. You can actually learn more about the APTC program and the requirements at healthcare.gov, or feel free to call any of our local offices around the state. I'm going to turn it over to Jason. Thank you.
Thank you, Chris, and thank you everybody for the information you shared there. We're going to open this up to questions. We have a large group today. We have 438 attendees that are logged into the webinar, so thank you all for joining us today. Like we said in the beginning, these are unprecedented times and there's a lot of questions, and really when we're going through this, we just want to let you know that we're here for you. So if you have any questions about your coverage, telehealth, prescriptions, or anything surrounding COVID-19, please reach out to your BCBS rep or any district office if you need to talk to somebody in person. And then also, when we go through this, I'm going to put the resources page back up there again so that all of you can see that and go online and get any information as we know it. So I'm going to open this up for questions. During the registration process, we had a few great questions come in. And as we're going through this now, a couple of you are sending in some great questions online. So we're going to get to as many as we can, like we said. We're going to limit to the content that we went through today. And we do have a hard stop that we're going to try to wrap up by 11 or 11:15 here. So we'll get through as many as we can. I'm going to do a quick sound check again to make sure that all our panelists online. Chris, Kalesa, are you there?
Yes, sir.
Hi, Chris. And Crystal and Mike, are you there as well?
Good morning, everybody.
Thank you guys for joining us. So as we started this out, we had some questions in, like I said, that came in during the registration. I'm going to start with those, and I encourage you all to that are listening in still to keep asking questions in the questions panel in the webinar, and we're just going to go through them, and hopefully we'll get through most of them by the time this is done. The first one is, many of you were concerned about keeping your employees covered even if they had reduced hours or are furloughed. Chris, you addressed that in your section initially, but could you go over those coverage extensions again?
You bet. So, if an employer reduces their hours for employees because of their current, because below that current eligibility guideline that's outlined in their health plan, Blue Cross is going to be flexible in working with those employers to keep their employees on the health plan as long as the premium's paid for the health plan. That's kind of the key thing. So as part of this flexibility, we'll work with the employers, related to the premium payment too. So if they have furloughed employees, laid off employees, that's, or their hours are reduced, we're going to be flexible. And again, it's just kind of bringing it down to if the premium comes in the door and those people are on the billing, we're going to work with you and keep them on the billing for them to be covered.
Thanks, Chris. I hope that addressed your questions. So stay with Chris here. There's also several of you on the webinar with self-funded plans. Chris, can you talk about what applies to self-funded plans and where they should turn for specific information if they have questions?
Yeah, certainly. The self-funded employer is required to, pay for the testing piece of the COVID-19 test. So we're making sure that we have that piece covered in there in the coverage. If, for example, if an employer says, self-funded employer wants to extend that to include telehealth for other items or treatment, maybe even related to COVID-19, that's when I would suggest they talk to their Blue Cross Blue Shield rep about extending that coverage. And I think somebody had posed a question early on about an amendment for their plan being needed. And no, there won't be a needed amendment for that additional coverage, but just reach out to your Blue Cross Blue Shield rep and they'll work with you, the self-funded client, to enhance those benefits if you desire to do so.
Thanks, Chris. And I'm going to stay with Chris for one more here. You're popular today, Chris. There were also a few questions that came in about coverage for COVID-19 treatments. Could you reemphasize what Blue Cross Blue Shield North Dakota is covering when it comes to treatments?
Oh, you bet. And that coverage is for, from our press release back last Thursday, Blue Cross is actually waiving all cost share for testing and treatment related to COVID-19 for all of our fully insured business. So that's individual business as well as fully insured employer group business. And then of course that initial testing piece is covered if you're self-funded, and that's where that additional coverage, if you want it as a self-funded client, just again to reach out to a Blue Cross Blue Shield rep about enhancing the benefits that you might have right now.
Thanks, Chris. And just so you guys know, I'm gonna share my screen here again to bring up like the updated resources that you guys can see. Again, I'm going to go through these bcbsnd.com/COVID-19. To keep moving forward here, we're going to continue with these webinars as we have enough updated information to host one of these again, and we hope you find those valuable, as well as I can get this over here. As well as news from Blue emails. So after this webinar is done, we will be putting those back out online, a recap of everything that's here in news from Blue and a follow-up email to this webinar. And then you can also go to the YouTube channel. So I'll just leave these resources up here so you guys can take note of those as we go through these. So I was going to see if Mike is still on. Can you hear me, Mike?
I can hear you. How are you?
Good, good. So there's this is probably a question for both you and Chris. For self-funded, you mentioned COVID-19 testing, telehealth covered and no out of pocket. How is testing done via telehealth? Or do you have any?
Question.
Yeah, go ahead.
Yes, it's a good question, Jason. Thank you. And again, thanks for everyone on the phone and online today. We appreciate your time and attention to this topic. It depends on the provider. So unfortunately, there's not a clear-cut line. Certain providers can do somewhat evaluation of COVID-19 effect, but by large, most of the evaluation of COVID-19 diagnosis has to be done through the appropriate CDC screening process. So it's more of a referral process. If people are symptomatic with COVID-19 symptoms, they'll likely refer them to the local provider for appropriate diagnostic testing.
Thanks, Mike. I appreciate that. So So in a 50-person company, another question here, in a 50 person company size based on how many covered participants or total full-time employees, regardless of covered employees? So Chris, I might have you ask that.
I guess
That
I'm
That
I was
that one
confused on
that
the
that that is
question.
a tough question. I think it may have been mistyped here. So I'm gonna go back to Mike here with the next question. Is Amwell cost only waived if visit is COVID related?
At this point, we have taken the decision to, for all of our fully insured clients, all urgent care visits, COVID-19 related or not, are covered, and that's based on CMS guidelines. Right, the idea is to avoid exposure to individuals by going to provider office for something like sinusitis or an earache. Additionally, we've taken that for our self-funded clients as well, that urgent care visits, regardless of COVID-19 or not, there is no cost share should that self-funded client elect to do that. You know, almost even more importantly, though, are behavioral health visits. So either through your local provider or Amwell, we think it's important to make sure that we're, again, decreasing exposure to COVID-19 through providers' facilities. So those visits can be waived for self-funded clients, and for fully insured clients, those are waived.
Perfect. Thanks, Mike. One follow-up to that was, when will Blue Cross Blue Shield begin paying for telehealth for counseling?
That's another great question. So currently, for our fully insured clients, those costs are waived during the COVID-19 period. For self-funded clients, those clients can make that election to waive that, so the member has no out-of-pocket experience. But we know it's an important vehicle to have an app to address behavioral health needs. So we ask that self-funded clients talk to their account management team from Blue Cross Blue Shield North Dakota. And for self-funded, those telehealth visits are all currently waived for behavioral health.
Thanks, Mike. So can you email the Amwell information, was a question that came up here. And again, we will be sending out communication following this presentation with information in regards to telehealth. So as Mike, you had alluded before in the presentation, that there was a couple things that you need to enter as far as a code and a coupon when you're going to Amwell. So I think we will relay that information to everybody that's on the call. So
Sounds good.
So in the event of a COVID-19 diagnosis, out-of-pocket costs are waived. Does this include deductibles? Chris, maybe you could take that one.
Yeah, good question. I think I'd referred to the press release that we had last Thursday. So on April 2nd, we informed folks that we would be waiving cost shares for all copay, deductible, co-insurance for all COVID-related treatment, testing and treatment. And then that, again, was for all fully insured business, whether it be individual plans or employer group.
Perfect. Thank you, Chris.
Yeah.
So I'm going to go to a question from Amy here. And I think this is a great question. And she asks, is this information being shared with our staff through Blue Cross Blue Shield? And this is a two-part question. Or should we be sharing as business managers and HR leads? So Chris, maybe you could take that one to start out with.
As far as sharing the information, we can certainly make sure that internal staff has the information provided here, whether or not they were part of the distribution list to begin with.
Okay. And as an HR lead, I think I would encourage you to share any applicable information with your staff as well as it relates to this webinar. So so to answer her second part of the question, if Blue Cross is sharing, how are you communicating this out? I think you answered that, Chris, that we could add them to the email distribution list if that was something that you would like. So
definitely.
Another question came in here. What are options for those losing jobs in employer-provided coverage that can't afford COBRA? Does North Dakota Unemployment or CARES offer help?
Well, there may be, this is Chris, so I thought I'll pipe in here. There may be assistance through the CARES Act, but I know that if they, this would be a qualifying event if they lose their job, so they could certainly check at healthcare.gov to see if they would qualify for the APTC, the tax credit available to them enrolling with individual coverage.
Thanks, Chris. This is a kind of a three-part question, and it involves cost sharing in-network and out-of-network, Chris. So related to COVID-19 diagnosis, can you elaborate on no cost sharing? So this attendee has HDHP, so a high deductible health plan. Is the deductible waived if I'm hospitalized?
According to our press release from April 2nd, it does appear that all cost shares are waived, including copay, coinsurance, and deductible, and they'll be paid at the in-network rates. So that out-of-pocket costs include incremental medical copays, deductibles, coinsurance charges related to any treatment of COVID-19.
And then the last part of this question was if we could explain any differences between in-network and out-of-network providers as it relates to that.
I would say that from this statement, it appears that everything would be covered at the in-network level. So if they went to an out-of-network provider, they should be paid at the in-network rate.
Great. Mike, I'm going to come back to you now. We've got a few more Amwell questions. One was just simply, what is Amwell? And then I think if you could elaborate what telehealth services would not be covered for cost share.
Sure. And it's a great question. So Amwell is a national provider who's been in the quote unquote telehealth business for over a decade. And it allows us to provide online video visits across the country, regardless of where our membership resides. We still recommend the use of local providers. If you have a relationship with them, please check with them to see if they can provide telehealth visits. But Amwell does provide us the parity across the country for our membership. We've had a relationship with them since 2018, and they are basically used for urgent care type visits. So if you have sinusitis and earache, again, things that are probably not COVID-19 related are best used to be sought care through Amwell. And they cover specific things like urgent care, behavioral health, both psych and therapy, as well as nutrition and lactation counseling. But your local provider likely has a larger bandwidth of services they provide. Certain things that aren't covered by telehealth, and we're following CMS and CDC guidelines, elective procedures, chiropractic care, and some other services are not covered by telehealth at this time. And again, we're following both guidance from the CMS and CDC facilities.
Great, thanks, Mike. So we have a question here. Do you have a simple list that explains to self-funded plans what has been put into the plans and what needs to be requested to be put into the plans to comply with the mandate?
This is Chris, so I think we can certainly make sure we include that detail in the answer to the question. So when we provide the Q&A out, we'll make sure to include a more detailed list there. It's mainly the testing piece of it, and then we'll include anything else that might apply as well.
And Chris, this is Mike. Correct me if I'm wrong, but we're not requiring any manipulation of contracts or anything at this point due to the pandemic. These are services we're doing to protect our membership and clients' membership, so there is no benefit plan contract manipulation needed at this time. Correct?
Correct. Yep. No amendments needed. We won't be doing an amendment that self-funded clients are used to. We won't be doing that amendment piece of it, just due to these extenuating circumstances.
Yeah. Thank you.
Perfect. Thank
That
you, guys. A couple more questions here. So if a self-funded plan elects to waive costs, that means that the employer is paying the costs instead of the employee, right?
Yeah, this is Chris again, so I'll take that one. And yes, the answer would be if the employer decides to pay those, then the employee would not have those cost shares, obviously. And then whenever the employer is paying a service, that does accumulate towards the individual stop loss of that person they're paying the service for.
Perfect. Thanks, Chris. And just to circle back about, communicating with, employees, HR folks out there that are listening in, I would encourage you to share the bcbsnd.com/COVID-19 website address with them. If you just go to bcbsnd.com, there is a banner that will take them there as well. Because we are going to keep that as updated as possible as this pandemic progresses, just to keep all relevant information out there as quickly as we can to keep everybody updated. So another question coming in here, and this is regarding prescription drugs. Will any mental health related issues, drugs prescribed, etc., caused by COVID-19 be covered? So I don't know if
Crystal, I can.
Yes.
Yeah. So at this point, we are certainly evaluating any COVID-19 related treatments, and we really highly encourage members to get in contact with case management if they would have a COVID-19 positive test. We haven't necessarily made the leap to covering any medications that would be kind of secondary to COVID-19. But certainly we would encourage members to continue to talk to case management and keep in contact with us to see if there's any way we can help.
Perfect. Thank you, Crystal. There was one comment here that this went very quickly. It was a pretty quick start out into this thing. And they asked us if there's a printed summary for self-funded plans. For all of you that have joined us now and missed maybe the beginning of this, I will mention that we are recording this session, so you can go back and listen to this at a later time via our YouTube channel, more than likely. So that'll be communicated in the follow-up email to this. And you guys will be able to watch this in its entirety to get the whole story again. So another question that we had coming in, was it mentioned that probationary periods are waived? And I think, Chris, you did touch on that right away.
Well, so the employers, this is Chris, and the employers typically set their own probationary periods, kind of the time period they want that employee to work for them. When that employer has a set probationary period, we're going to allow employers to remove or reduce those probationary periods that they had set. And if they want to make a new employee eligible sooner, just let us know what you want to change that probation period to. So feel free to reach out to your Blue Cross Blue Shield rep, and we can get that confirmation in writing from you, and then get that probationary period removed if that's your desire.
Perfect. Thank you, Chris. Another one coming in for Chris as well, and asking that, did you state that waiving of costs only applies to fully insured plans unless the self-funded plans elect to waive?
Yes, that is correct. So initially Blue Cross Blue Shield decided to waive it on the fully insured side of business, but we wanted to make sure that self-funded employers would be opting in for that extra payment. So they're still going to pay for the treatment related visit, but if they want to waive all cost shares on it, or I'm sorry, the testing piece of it, but if they want to waive all cost shares on all the treatment included, that's something that just reach back out to your Blue Cross Blue Shield rep so we can make sure that we note that for your particular employer group.
Perfect, thank you. Chris, this is another one for you. So for the premium grace period mentioned, based on the company size, is company size based on how many covered participants or full-time employees, regardless of covered employees?
I think no matter what your size as an employer, if you are having some struggles with paying the premium, please let us know so that we can reach out to our billing department, inform them so that they are aware that, you know, hey, it's going to take this time period for us to get X dollar in. We could look at setting up payment plan options. But just again, I encourage you to reach back out in those particular circumstances because everybody's probably will be a little different. So I don't think there's a really good canned answer. And I don't think it's so specific to the size you are as far as how many contracts you have on your employer group billing. Focus more on if you're having those struggles, reach out to us and we'll be more than willing to work with you as much as we possibly can.
Perfect, thank you. So if a person tests positive for COVID and the doctor says to stay home, is there any help with stay home costs? I don't know if we have an answer for that right away.
Jason, this is Mike.
Yep.
That's a great question. I don't know, Lacey, are you on the phone? Any thoughts from a clinical perspective on coverage at-home care costs of the diagnosis of COVID-19? My assumption, and correct me where I'm wrong, would be if a diagnosis is incurred, treatment expenses are covered. But Lacey, any thoughts?
Yeah, I'm on, Mike. Thanks. I'm Lacey Bergen, the Vice President of Clinical Integration. I don't know that we've had any discussions particularly around that, but I would assume similar to your statement that if it's COVID-19 related, it would be.
Okay.
Thank you, Lacey.
Thank you. So what needs to be done if our self-funded plan wants to opt in to cover out-of-pocket costs?
This is Chris, so I'll just kind of share out to that self-funded employer to reach out to your Blue Cross Blue Shield rep, and we'll get the details from you as far as who you are and that you're wanting to add the cost for or waive the cost share for treatment, and we'll add that to the benefits, but not, again, we won't make a formal amendment of that.
Perfect. Chris, this is probably another one for you. So going off of allowing new employees to access their health plans sooner, is there no waiting period, or what is the new waiting period? And they did give an example here, Chris. So if an employee begins work on 4/1, April 1st, are they eligible to begin health insurance on April 1st now?
So leaving that up to the employer to determine that eligibility. And again, if they wish to remove any probation period that they have previously set, our general rule of enrollment is to enroll folks on the 1st or the 16th of a month directly following their full-time employment date. And then if you as an employer wish to offer them coverage on the day of hire, as long as it's the 1st or the 16th, we can accommodate that. So just let us know if that's your desire.
Perfect, thank you. Chris, this is another one for you as well, and it's a clarification on a previous one. So, you know, as the employer, they keep paying premiums for full-time employees while they're on furlough. Is it up to the employer in the premium portion, if the premium portion will need to be recouped later when the full-time employees are back to work?
Yeah, great question. And since the employer does that today, and if they discontinue taking that amount from their paycheck, that's something that they'll need to revisit at a future date when they're able to take that dollar amount from their paycheck again. So yeah, we kind of just look at the total premium coming in. We don't necessarily always know, especially our billing department doesn't know which portion of that premium is paid by the employer versus the employee. So very good question, and I hope that helps.
Perfect. Chris, this one's for you as well. If a self-funded plan opts in to cover out-of-pocket costs, it's only the out-of-pocket costs related to COVID-19, correct?
Yes, that's correct, unless, of course, they want a lengthier discussion about other costs that they want to change on their plan entirely. But right now, at this point in time, assuming that it's not the renewal, our focus right now is COVID-19, and that cost share waiving would be specific to COVID-19 testing and treatment. So,
perfect, thank you. We have a question here that can you elaborate on the possible option of employees paying premiums with a credit card?
Well, this is Chris, and I just checked with our finance department, and it was supposed to have been updated last night in our system to allow this. So I'm guessing that if not as of today, in the very near future here, probably this week, we'll be able to allow employers, and we've kind of focused on small employers first, but just let us know if you have that desire as a larger employer, but we'll need to confirm that with our finance department as far as if they'll allow the large employer to do that. But we'll get the details of how to submit that payment via credit card as soon as we know the details and confirmation that it's working on our end. So thank you very much. Yeah.
Perfect, thank you. We had one come in just saying, please include the Q&A on the YouTube replay, and I can assure you that we will break this out probably into one, maybe two different videos when we post this on a video link. So the Q&A portion of this will be available as we move forward, but I think the bigger thing is to watch your follow-up emails, because we will address a lot of these questions in a recap, kind of as an FAQ of the most common threads that we've seen through this webinar. So again, there's a lot that's changing, so we're going to keep addressing these as we go through this. So we have one more question that came in. Is there a deadline for self-funded groups to decide to opt in?
Well, this is Chris, and I guess that's a really good question. So I'm not sure that there's a deadline per se, but I know that a lot of this coverage is through May 31st. So I would say the sooner you make your decision, the more comfortable employees probably will feel knowing that answer. And then, you know, just let us know if you come to that decision. Reach out to your Blue Cross Blue Shield rep, and we'll work with you at that point.
Perfect. Thank you, Chris. And again, I'd like to thank all of our panelists today, Chris, Mike, and Crystal. If anybody has any other questions, you can type them in. Otherwise, we are kind of coming to the end here of a lot of the questions that were asked online during the webinar, and we appreciate all the questions that were asked. Again, I'm going to reiterate that these resources that you're seeing on the screen right now, visit those again for constant updates at bcbsnd.com/COVID-19. As the need arises and things change, we may do another webinar like this. I hope you found these useful. And look for a follow-up email from this that recaps all this information. And then again, to keep reiterating, we will be distributing this video. So if there was people that you know that were unable to make it, you will be able to watch this webinar at a later time as well. So I don't see any other questions. Mike, Chris, Crystal, if you have any other closing thoughts at all.
Not at this time. Thank you.
Okay. So
yeah, Jason, this is Mike.
Yep.
I just want to reiterate how appreciative we are that everyone was able to get on the call today. We know it's uncertain times and it's a very fluid environment, and so we appreciate the opportunity to get in front of this audience to let them know where we're at now. These things are likely to change based on circumstances, but we're grateful for everyone listening in today.
Thanks, Mike. On that note, I guess I'm gonna probably end the webinar here, and I'd just like to say thank you all for joining again. We had a great attendance, 325 people logged into the webinar. And I'll leave you with everybody to stay safe, stay healthy, and stay home, I guess. So hope this all finds you well, and until we talk next time, thanks for joining. Goodbye, everybody.